Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, welcome to the podcast episode. Thanks for joining me again this week for this week's episode. Today we're going to focus on a particular use for Botox or neuromodulators, and that is for migraines. Now, as you may know, Botox or neuromodulators, and when I say neuromodulators, I'm using that term interchangeably with Botox, but there are other brands of the neuromodulators such as Xeomin or Dysport, for example. Nevertheless, in this podcast episode, I'll probably be using Botox and neuromodulators interchangeably. As you may know, Botox is often used for cosmetic purposes to help with the wrinkles in our face, all over the face really, whether it's for the 11s in the middle of the brow, or whether it's for the horizontal brow lines, or whether it's for the crow's feet around the eyes. There are lots of ways that we can use Botox cosmetically. But Botox has a whole bunch of other uses as well, and one of them is a therapeutic use specifically for chronic migraines. And for some people who suffer from migraines, this is a total game changer. It really does make a huge difference on their quality of life. And there have been many studies that have shown that Botox can have a significant impact on this. So today, given the fact that we do Botox treatments at Anti-Aging, and we do therapeutic Botox treatments as well for migraines, I thought it would be great to just talk a little bit about it, hopefully answer any questions that you may have about it. And if you know someone that is suffering from migraines and would like to have more information about Botox for these headaches, then of course feel free to reach out to us and we'd be happy to have that discussion with you. So let's talk a little bit about the use of the Botox and the people that this would be most appropriate for. When it comes to having Botox for migraines, typically it is used for people that have chronic migraines. What it means specifically is that the Botox chronic migraine treatment is for people that have 15 or more headache days per month. So if you think about that, that's like one headache every second day. And at least 8 of those days are migraine days. So when it comes to migraine headaches, there are specific features that characterize a headache as a migraine. For example, migraines tend to be on one side of the head. They also can be accompanied by aura, which would be some type of visual change, but not always. And these tend to be more severe, and they can last anywhere from 4 to 72 hours as a headache on its own. So the first part is having the correct diagnosis. And for that, of course, you can go see your family doctor and you can get diagnosed with the migraines. Now, if you are being treated for migraines and you have tried at least 2 different medications for the migraines, then you may be eligible to have Botox treatments and it would be covered by insurance plans and you would only pay an injection fee, which is actually a fortunate way this is done because, as you know, Botox can be a little bit pricey, and this is a wonderful way to get the treatment. But again, in order to be eligible for this, you need to have at least 15 headache days per month. You have to have at least 8 of those headaches be migraine days, and your headaches typically have to last for 4 hours or more, and this has to have been going on for about 3 months. That's how we can make that diagnosis of chronic migraines. Now, once we have made that diagnosis and you have tried 2 other treatments and it hasn't worked, then you are now eligible for the Botox as a treatment for migraine. Botox, it's also known as onabotulinum toxin A, is a neurotoxin produced by the bacterium Clostridium botulinum, and it works by blocking the release of acetylcholine, and that's a neurotransmitter involved in muscle contraction. When we inject that into different muscles around the head and neck, and I'll describe those in a little bit, it helps to relax the muscles, and this in turn helps to reduce the severity and the frequency of the migraines. This also helps just to generally reduce muscle tension and inflammation in the head and neck, and that can also, on its own, help to relieve some of the headache pain. Now, where do we actually inject the Botox for migraines? A lot of this protocol has been developed based on a very renowned research study, and this study protocol is called the PREEMPT study protocol. What this stands for is the Phase 3 research evaluating migraine prophylaxis therapy. And this has involved 2 different randomized double-blind placebo-controlled trials, and these trials involved over 1,300 patients with chronic migraines, and it showed that Botox injections were effective in reducing the number of headache days per month compared to a placebo. Other studies have also demonstrated the efficacy of the Botox in the treatment of migraines. And this is all about where to inject the Botox, and I'll list some of the locations that we do inject the Botox as part of the protocol. We do inject it to what's known as the corrugator muscles. These are the muscles on top of the eyes that helps to bring the eyebrows together as you furrow your brow. It's also injected into the procerus muscle. This is the muscle that is right between your eyebrows that, again, is involved when you are making that angry expression with your muscles. It's also injected into the frontalis, which is the forehead muscles. It's injected into the temporalis, which is the muscle on the side of the head, one of the muscles on the side of the head. Now, the Botox is also injected into the back of the head, where there are a lot of muscles as well. It's injected into the occipitalis, which is one of the muscles at the back of the head. It's injected into the cervical paraspinal muscles, which are the muscles just at the base of the skull on either side of the spine. And it's injected into the trapezius. So that is the big, broad muscle that forms the back of the shoulders. Now, when you add all of these different injections together, the total dose for Botox treatment for migraines is 155 units. This is, in fact, the recommended dose for patients with chronic migraine according to this PREEMPT study protocol. But you can actually go up to 195 units depending on the particular patient's migraines and the characteristics of the headaches. And this is why it is really important to consult with somebody who's very experienced in this protocol. The actual procedure is simple in the sense that it's a very, very small needle, a tiny needle, and this is done very quickly because each one is just basically a tiny little poke and you move on to the next site. And while it is a relatively larger dose of Botox overall, it doesn't take more than a couple of minutes to do the entire treatment. Now, it is important to note that with any injection, there are possible side effects. This can include some mild bruising, some mild pain in the site. And because we are injecting this into muscles to essentially relax the muscles, in some cases, you can get some muscle weakness or some eyelid drooping. But that tends to be more so in the case of people that are doing these injections that aren't as experienced and don't know exactly where to place the Botox. So again, it's really important to discuss the risks and benefits of the Botox with an experienced healthcare provider before going ahead with this treatment. Now, having said all of that, this is a very, very effective treatment for chronic migraines. If you are suffering from chronic migraines, if you know someone that is suffering from chronic migraines, if you have tried a number of different treatments and you're still struggling with it, then I encourage you to consider Botox as a treatment option. Feel free to reach out to me. I'm happy to talk to you about it at antiagingvancouver.com or at my website, drterifisher.com, and hopefully we can help you to get those migraines under control. Please share this with anybody that you think may benefit from this as well, and hopefully we can help that person with their chronic migraines as well. Thank you again for tuning in this week. It's always a pleasure to chat with you, and I look forward to chatting with you again very soon. And remember, live life well.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.